Okay.
Hello, everyone, and welcome to Stepping Stones Nurse Academy's panel discussion. Tonight, we're going to talk about pivoting to the practice of nurse case management beyond the bedside. My name is Lori Schellenberg, and I'm the owner of Stepping Stone Nurse Academy and Stepping Stone Advocacy Services. At Stepping Stone Nurse Academy, we provide a supportive community to help nurses pivot to non-traditional nursing roles through training, mentorship, and coaching, and also internships beyond the bedside. The Academy is a career transition platform built by nurses for nurses. We offer nearly 30 specialized courses, mentorships, internships created to help these nurses to pivot to different careers. Each course provides the exact roadmap and insider knowledge needed to transition into an alternative healthcare career without returning to school or starting from scratch. Many of these careers offer remote or hybrid choices and opportunities, giving you the flexibility to work from anywhere while using your valuable nursing expertise. Tonight, we're highlighting the practice of nurse case management. We offer a comprehensive case management course program that consists of a self-paced foundational course developed by Deb Cook, who will be our moderator tonight. Thank you, Deb. Anne Llewellyn, she's driving this tonight and is joining us and is one of her and I are instructors for another type of case management program within workers' comp. Uh, we're both sides are case management products or services, but they have a different knowledge base that you have to take with you. So in the future, we hope to offer a course and a panel discussion on that. Case management's evolving very rapidly, and it's one of the most rewarding and impactful paths that a nurse can take. With many seasoned case managers retiring, the next generation of nurses has a unique opportunity to shape the future of case management. It's an exciting time for all of us. So, to start the conversation, again, welcome Deb Cook, our moderator for tonight's discussion. And Deb, can you tell us a little bit about your background and what was your why behind your decision to become a case management course instructor and mentor at Stepping Stone Nurse Academy?
Yes, thank you so much, Lori. Good evening, everyone. My name is Deb Cook, and as Lori said, I'm a case manager. I've been in case management after my initial clinical career as a registered nurse in pediatrics at Children's Hospital in Philadelphia. And currently, I work as the corporate director for care management for the Shriners Children's System. And I really was so intrigued when I first happened upon Lori's post on LinkedIn about nurses transitioning out of bedside nursing into case management and other specialties, because case management has really provided me with such an interesting challenge and opportunity in my career. So I've done many different things in my career, but I think my favorite is doing case management and advocacy. And so that's why I was interested in putting together the little course, for the platform, and also helping to organize this event with others tonight. So what we're going to try to do tonight, we do have a very distinguished panel of case management experts at various stages in their career. And we've prepared some questions that I will be asking the various participants to respond to. And of course, we also want to save time near the end for your questions, which you can place into the chat throughout the program. But before we get started with the questions, I'd like to just quickly go around the virtual roundtable here and allow everyone to introduce themselves. That is our panelists. And Christine, if you wouldn't mind starting and then tag the next person, please.
Absolutely. Okay. Hi, everyone. My name is Christine Fisher. I am a registered nurse and a certified case manager. I have been at this now for many, many years, as has Deb. I work for Shriners Hospital, so I kind of work with Deb alongside Deb in the case management arena at this hospital, which I love. Working with these children. I have been in case management in multiple roles, and I'll talk more about that as we get into the question and answer period. But I agree with Deb. It is an exciting field to be in. There are so many opportunities within case management. I kind of started out on the medical management side of the fence, which is kind of a broad way of describing utilization management slash case management under one umbrella, um, doing a little bit of both. And case management is more people oriented. You can really be a patient advocate, and use your nursing knowledge to guide you along your path. So I feel that I made a really great choice.
Thank you, Chris.
Mhm.
Mark,
And we'll go with Mark next. Okay.
Hi, I'm Mark Renna. I am actually a registered nurse and a certified case manager as well. I have had various roles in my career, from acute inpatient to insurance world to home health hospice, as well as my biggest love is with case management. It is currently I work in St. Louis for BJC Health, and I help coordinate case management across our system, and working with all the various hospitals and the different populations. And I find it's an exciting time to be in case management. So with that, I will pass it on to Stephanie.
Hi,
Which
I'm Stephanie. I've been a nurse since 2015, so this will be my like 10th year, but I am taking a break from nursing. I have twin daughters and they keep me busy. So I've been taking some time away from the profession. I am hoping to like get back into it eventually. I've done a lot of like gig work as far as nursing, but I would say the main specialty I've worked in is behavioral health. So I've worked with like adolescents all the way up to like geriatric adults. Um, yeah, I was gonna say the only like nursey thing that I'm kind of doing now is I volunteer for the Nurses Honor Guard of Bucks County. So I don't know if you're familiar with them, but it's a group of volunteer nurses, and we go to funerals of nurses who have passed away, and we just do a little ceremony for the families to help them grieve. So yeah, that's what I'm doing right now in the meantime.
great. Thank you so much, Stephanie. And now we'll go to the other Stephanie, please.
Hi, my name's Stephanie D'Annunzio. I have been a nurse since 2020. Perfect time to jump into the profession. Um, but I work at Cooper Hospital in Camden, New Jersey, and I started out in med surg. I went into cardiology research after or kind of to get away from the bedside during COVID. It became a lot, but I went into research for about 3 years, and now I'm in case management for about a year now. I went on maternity leave, but now I'm back. And I love it. It's the perfect blend of getting your bedside time in, doing like assessments, social assessments, and some nursing education with the patient, but also helping them when they get out of the hospital, which is something that you don't do at the bedside. You kind of do treat them acutely, and then you never really know what happens to them after they leave the floor. So it's nice that you can set them up for success, and they're pretty grateful for you. But I really like this position, and really grateful that I fell into it. But I want to stay in this for as long as I can. But yeah, it's an honor to be here.
Thank you so much, Stephanie. And next we'll go to our last panelist, Hilda, please.
Deb, she can't speak.
Oh,
She's
okay.
only on chat. So,
I'm sorry to hear
Oh.
that. All
Yeah.
right. Well,
um,
okay. Well, thank you, Anne, for that. All right. Well, then we'll get started with our questions. And also, I wanted to just say that we are going to try to keep it to an hour. So what we'll try to do is stop around maybe 10 of the hour and try to answer any questions in the chat. we certainly are willing to stay beyond that, but we want to be respectful of everyone's time after probably a long day of work and maybe some other financial and family responsibilities that you might have to get to after working all day. So let's start off with Mark, if you wouldn't mind describing your own pathway, how you transitioned when you made this switch from being perhaps a bedside or clinical nurse into case management. How did you identify what area of case management and what steps did you take to begin to make that transition?
Sure. Thank you for that. When I transitioned from the bedside, I had gotten into a management role, working in home health and hospice, as well as in a big health system. And with that, one of the things that really intrigued me was the different levels of care. And I took an opportunity to learn about those different levels of care and really found that the whole continuum of care to be so interesting and fascinating. But one of the things that I did notice while I was working was the fact that it seemed like we were just doing medical treatments, and I was like, who's paying for all of this? So I had a little bit more of a business side that started to come out as I worked further in my career. And with that, I learned to work with insurance companies. I actually went to work for an insurance company and learned all the utilization rules and management of that stay for the patient. And with that, I really felt like I wanted to be able to help the different patients coordinate the care and move throughout the different levels. So it's been quite a transition, and that was kind of my journey.
So can I, whoops, oh, she's a, so I'm curious. So you started out on the hospice side, did you say, in
Mhm.
home health?
Yeah.
And we don't have a panelist here that is currently doing home health case management on here, but it is a gateway that a lot of us have went when pivoting to case management from the hospital. I feel like Christine or Deb, maybe you can chime in too, but I feel like I get a lot of calls from nurses, asking me about career transitions and which one, and we talk a lot about the different courses and non-traditional roles. And so I think it's really important especially for me to be guiding nurses to different areas to know that home health piece is important. I don't know how Christine, or Stephanie or Deb, a little bit more, maybe they can share that when the questions come around, but I find that very, that's I hear that a lot.
Yeah, just to chime in, this is Christine. I did not have home health experience myself, but I can see how you could easily transition from home health into this role,
Yeah.
because when you're working with patients in their home, you're working with their families. Um, you're looking at their social issues, right? Social determinants of health. You might be able to pick up that they don't have, the appropriate housing, shelter, food, transportation to get them back and forth to their doctor's offices. And so you automatically are starting to think along those case management lines without really realizing it, right?
Right. Right.
And so when you actually take that leap into case management, you find that you are doing a lot of those things already. So that is a nice smooth transition. And as Stephanie pointed out, when you're in the hospital and you're discharging a patient as an acute care nurse, you're discharging them and you're reading the discharge instructions, and you understand this, that, and the other thing. You have your meds, but you don't really get into that level of making sure that they've got their first doctor's appointment made, that they've got a way to get to that doctor's appointment, that they've got their meds, they have a way to pay for their meds, and all of those things. That's where the case management piece kind of falls in. So you can see it on both sides, both the acute care as well as on the home care side of the fence.
Right. And I think it's really important for nurses out there that are looking into case management to realize that a lot of what they have in the translatable or transferable skills fit so perfectly into case management coming from different places,
Hmm.
a different perspective,
Yeah.
right?
For sure.
Absolutely. Yeah. So both Mark and Chris have mentioned utilization management. Chris, would you just comment on what you see as the difference between utilization
Sure.
management and case management
Sure.
practice and how perhaps one helped you, better transition to the other side of
Yeah.
the fence? Well, thank you.
Yeah, sure, absolutely. So they're closely related, but they're different. Utilization management is how I started out.
Mhm.
I went from acute care to utilization management. One of the reasons I did that has to do with what Mark was saying is I was looking around. I actually, in my acute care experience, was working on an eye surgery floor as an RN, looking at this woman who wasn't working weekends, wasn't working holidays. And I said, and she wore a suit to work. And I said, that's what I want to do. Right. And I was on an eye surgery floor and I said the same thing as Mark, who is paying for this? Right. Because back in the day, we had cataract patients in for 2 days, right? And here I am with my RN degree, and all I was doing was using warm compresses and putting eye drops in the operative eye. And I said, what a waste of Medicare dollars this is, right? So once I learned what utilization management was, and that's what this woman was doing, was reviewing charts to make sure that that patient was meeting Medicare criteria. I said, Medicare criteria, that's really interesting. And I bet you I could teach them a thing or two because this patient should not be here for 2 days for their cataract. Um, so anyway, that's utilization management is looking at the appropriate length of stay. You're looking at the appropriateness of setting, meaning inpatient, outpatient, skilled nursing. There's so many different levels. I also worked for a company where we only did utilization management for NICU babies, and NICU babies can be level 1, 2, 3, 4, and some even have a 5. But there are distinct criteria. You'll hear that word criteria in utilization management a lot. That really outlines exactly what level of care that baby should be in. And if they're not on, a ventilator or what have you, then you don't get bill for level 4, right? So there's all these different level NICUs. And what we were finding is that hospitals were kind of slipping people through, babies through at a higher level of care than they really needed to be. And that is a real difference in dollars when you're looking at a level 4 versus a level 3 versus a level 2 or a 1, right? So we on the utilization management side would pay attention to that. And we made sure that those patients were in the appropriate level of care. And if they weren't, then we would take that information and we would give it to our medical director, who would get on the phone with the doctor at the hospital. And then lo and behold, they would lower the level of care for that baby in most cases. So that was the utilization management side. Looking at dollars, a lot of insurance things, working with the payer, looking at approvals and denials, and being a patient advocate to try to help patients get what they deserve from those insurance companies when it was medically necessary. So, medically necessary is a big terminology on the utilization management side. On the case management side, I think the biggest difference is that you are really there's a lot of focus and emphasis on that patient advocacy role. You're speaking with the patient, you're helping the family. Right now in care management at Shriners, we have, some pretty medically complex kids, right? And so and they come from all over. They don't even necessarily speak our language. We work with interpreters. And we have to really advocate for those patients and making sure that they're getting really what they need. And so it's a little bit of a difference, but there's a lot of intermingling between those two roles. I guess that's
Yeah.
the best way I can describe it. Does that work for you there, Deb?
Yeah, that's perfect, Chris. Thank you so much. And I
Mhm.
see Anne has a comment.
Yeah, just to jump on with what Christine said about the difference between case management and utilization. And I think your example was good, Christine, where the baby was in the neonatal ICU and getting care, and then the coding was wrong, or they weren't being appropriate level of care. Where in case that is a reactive situation.
Mhm.
Our case management is looking at proactive through
Mhm.
education, through empowering the patient to take responsibility for their care. Like you said, to send that patient home as a case manager, you would educate the person who had cataract surgery, how to do their drops, how
Mhm.
to do their warm compresses so they could do it themselves at home. They want to be home too.
Mhm.
So for new people looking to get into case management, being proactive, helping people be able to take care of themselves when they leave your setting is really what our role is as a case manager.
Mhm.
Yeah, that's really good, Anne. Yeah. Changing gears slightly, Stephanie, I wanted to start with you and ask you, I know you said you started your nursing career during COVID. What suggestions or ideas would you have for those in attendance tonight in terms of making that first step into the case management role? How did you go about doing that, and what advice would you have to give to someone who might be interested in doing that?
Um, I would say it's important to multitask or be able to multitask. You have to work well with a medical team, um, and I think being able to ask for help. There's coming into this role. There's a lot of not everyone knows the answers to insurance questions or referral systems, authorizations for rehab, and things like that. So, medical questions, but working in different departments, you need different discharge needs. So, and you learn a lot every day. So, and
For sure.
no day is the same. So, yeah, I think so.
All right, thank you. Mark, what would you say? What advice would you give to someone who's interested in moving into this practice?
I would say take as many opportunities to learn different aspects of healthcare as much as you can. I think everything from the insurance to coding, open your ears and listen to what's going on, whether it's in the hospital, it's home health, and you will use your nursing to know what to expect at a certain level of care. And the idea and the work of a case manager is really not only to focus on the level they're at, but what is the next level? How are they going to get there? Kind of like Chris was saying, are they going to be able to take care of themselves when they leave the hospital? Do they have the transportation? Do they need home health, the resources that they need and the caregivers? So it's not only focusing on the here and now, it's also helping to plan for the future for this patient to be healthy and getting the right care at the right time. And that's really kind of the key. Really keep your ears open and learn from everyone around you.
Perfect. And Christine, how about you? What advice would you have?
First of all, you need to learn how to use your mic. I almost couldn't. I couldn't find it for a minute there. Um, I think just pivoting into the case management role, I think my advice is that don't be afraid that you're going to lose your nursing, because you have to be a nurse to do this, right? You cannot just come off the street and start working this role. There's so much clinical involved, and I think that some people are afraid that well, I'm not going to be a nurse anymore, and we've all heard that, believe me. They think we're, oh well, when you used to be a nurse. Well, no, that's not true, and I think that it has a little bit of a bad stigma that way, but we all know that we're looking beyond that acute care experience, as we've talked about, and making sure that those patients are able to be as independent as they can be. And we are the ones that are putting the pieces in place to break down barriers to that, right? So we identify problems um, before they happen, as Anne was saying, and learn how to work around those, right? And make sure that things are in place to keep that patient as healthy at their optimal level of health, really is what we're trying to do. And that involves a lot of education. We teach them about their disease process. We teach them about their medications. We teach them about public transportation and other things that don't even cross an acute care nurse's mind. So um, we kind of do even more than that.
Yeah.
So there you go. That's my thought. I'm very passionate about my career choice. I do have to say.
I love that. Yeah. So, Anne, I know you've been such a pivotal national leader in the field of case management. I'm curious your perspective. And I know that you talked about at the last annual conference, this was a big theme about bringing new talent into the profession. What would you offer to the group on this topic?
Well, I really think, and this is why Lori and I really have teamed up and talk a lot about nurses. So many nurses come into nursing and they like what they're doing, and even without the challenges, but they get tired. This is a nice role to pivot. A more experienced nurse, after you've been in nursing maybe a couple years, 2 years, 3 years, and then move into case management. If you're in a hospital, go to the case management department and ask them to maybe let you shadow someone and see what they do, so you'll know what they do and know if it's something that you would like to do. There's so many roles, and that's why Lori developed the Stepping Stones Academy, to help nurses look for that career path. In many other areas of growth and development, I never really had a career path. I kind of stumbled onto things that led me into new roles that I took chances on and liked them, so I did them. But we today, with nurses coming out with bachelor's degrees, nurses coming into, or people coming into the field with advanced degrees already, and learning about nursing and then seeing the different opportunities. I listened to a webinar today they gave the 22, 25 legacy nurses awards recently. And these are women who were nurses, started out just like everybody else, coming in out of nursing school, going into their first jobs, but really because they had mentors and people who helped them get to the next level. The one woman I listened to, she has really been very uh, pivotal in doing data sets for nurses in informatics and really laying that whole plan of care and that whole workflow out so we know what nurses do. I mean, it was something that I never even really thought about, but somebody does that, and what in a way. So there's so many different paths, and if you want to make an exciting career, get to know the different roles that are out there for you. What interests you? I know we have Marianne Demola on the call today, and she is one of the most learned person in case management. She's a recruiter for case managers to help get jobs, and we can have her come on since we have a little bit of time, but open the mic, Marianne, just to say hello. But I think she could probably tell too, like, nurses have many skills that are transferable into many different roles. And learning what you want to do, what you like to do, and using those skills to get there. You learn to talk the talk, go to conferences, go to listen to these podcasts that are out there. I mean, I just stumbled on this through LinkedIn, that these legacy leaders and the 25 of them in the varied areas of nursing that they've impacted as doctors of nursing, and just I was just amazed by it. So yeah, I think we are lucky to be in nursing, and it prepares you for many areas. So I say the sky's the limit. You have to find what's going to get you going and get you interested. And other jobs, it would look like job hopping, where you go from one job to another. Nursing encourages that. Get in, see what you like, do your role. I mean, put your 2, 3, 5 years in the bedside, and then look to the next level, whether it's going into administration. We are leaders at the table in administration. Mark, when you said you wanted to know where the money, and you got into the insurance side, so you saw who paid for it. And then Christine, you saw how they were paying for it, but it was incorrect. I mean, we can identify that from our skills as nurses.
I think,
So
yeah.
it's just so exciting. And I'm at the end of my career, and I wish I was starting over, because I would love to go and be a DNP and go into that research area. I think that would be so exciting, but maybe in my next life I'll come back.
There you go.
I love it. I love that, Anne. And I love, Anne, thank you. Thank you for putting that message forward, frontward, right in center, because that's the whole purpose behind these hopefully ongoing panel discussions, to introduce other nurses and other non-traditional roles, so that nurses out there can dip their toes in into different, like you said, Anne, and Mark, you looked around for mentors and you gravitated and you had these nurses that helped you. And so I think nurses still can have that opportunity. I get over and over again saying, I didn't even know that was a job. I didn't even know that was a role that a nurse did. And, I did it. I pivoted out of necessity and curiosity both. And I think case management for me is where I stayed the last half of my career, in workers' comp case management. But it led me to so many cool opportunities that nurses don't even know how valuable they are. And so thanks to you all as being mentors and continuing. Stephanie, we're looking to you as new. I mean, we're going to be handing the hat off. And that's why I really love the fact that we were able to get all of us together at different parts in our career, and to explain a little bit about what we did, how we got there, what opportunities are out there. And I think that there are a lot. Case management for me, I haven't done that hospital side. That's the one side I did a little bit of review work, a little bit as a consultant at one point. But it's a world of opportunities, and I don't want to. I know you probably have a few more questions there, Deb, that you want to throw out at us. So
Yeah, thank you though, Lori. That's very helpful. And I do want to see if Marianne would like to just say a word or
yeah.
two. We would definitely welcome that. I know, Marianne, you weren't prepared, but we'd love to hear your perspective, because your guidance is so helpful to so many in the field.
Well, thank you so much, and just try to stop me from not talking, right? I appreciate it so much. One of the things that I say all the time about case managers is that you truly don't understand all the skills that you have. You truly don't. And that's something Lori and I did this whole series on LinkedIn, right? The cognitive blind spot, which I did a whole slide on in my last presentation at Detroit. I must say, Lori, you got props there.
I did not know that, but I'm glad you did. Maybe that's a good, could you expand on that a little bit? Because I think it's so true in what we're trying to depict here on this.
So one of the things that I do when I talk to case managers and I interview case managers is I start at the beginning of your career. I start right at the bedside, because there's so much that you just look and say, oh, well, I've only been doing this for so long. But some of you started being charge nurse within the first 3 or 4 years of your career.
Yeah.
So management didn't start within the last couple of years. It started 10, 15, 20 years ago, right? And you forget that. You just don't look at it. So you don't look at yourself the way outsiders look at you, or your peers look at you, or your patients look at you. So one of the things that I encourage you to do when you do your resume is don't do tasks. Don't write down things that you do. Write down, use the STAR method, the situation, the task, the action, and what was the result. And you really have to look at all the different things that you do. Like when you do a discharge on time, how much money are you saving the hospital? And it's beyond. I just talked to a CFO at a hospital the other day, and he said, it's not just that, it's the patient satisfaction too. We've reduced the risk of infection. It's increasing better outcomes. They get paid for that.
But Marianne, can I interrupt here because
Yes.
I want to point out something I hear over and over, especially as an entrepreneur and trying to help other nurses become entrepreneurs. It's very hard for nurses to talk about, now not from the review side, it's different, but when you're talking about your worth as a nurse and quantifying that. I remember in workers' comp, and you can talk about this too, but we were required on each case as a case manager to show our, what was the return on their investment from the insurance adjuster to using us as a case manager. So we had to learn how to prove our worth. And I think that's a very uncomfortable place to look at. It shouldn't be. It's not for me anymore. And it's not uncomfortable for me to ask my clients, right? In what I do in patient advocacy work to do. But I don't think back at nursing long ago or even today, that's not something we learn, right, Marianne?
It's not, and it's something that hopefully I'll get to talk about more at CMSA National. I have something
Yeah.
prepared, but it is something. If you look at hospitals, home care agencies, everyone puts out their profit reports, right? This is how much money we made. Well, if you're a case manager, you directly contributed to that bottom line, to that profit. If the hospital wasn't able to make their numbers, case management will tell you why. If I get on the phone with the director of case management and they tell me we don't have the support, they don't understand what case management does, I do not want their business. Instead, I want to pull every case manager out and put them where they will be valued.
And that's so empowering, Marianne, to hear those words, because I hear over and over and over how disempowered nurses feel today. And to hear you from the recruiter side say, look how valuable you are as a case manager.
You
I don't
absolutely.
think, I mean, it's so important. And it's such a good takeaway today. And I hope that we do spread the word about this and people, nurses start to look into this as a very empowering. It's been around a while. I remember when Ann and I started, Deb, way back, all of us started when case management, which was brand new, and they're just starting to become a profession. Like nobody knew like what to do with it. Like we all came together to try to figure that out. And now, Ann, we're saying we're handing it off. And now, what do you want to do with that, Stephanie?
Right.
What do you see for yourself in a case management role? And that's, I think, going and leaving and going out towards the end of our careers. How do we help bridge that gap? And that's what I'm trying to do and get the word about case management out there, because we need nurses that want to go into case management. I don't see it going away. Do you all on the panel?
No, but
No.
Lori, I will bring up two things that I put in the chat. Well, a couple things. First of all, the Stepping Stone Academy link to go in and look at the different offerings, the different courses that are out there. Just take a look at them. I mean, if you want to even write articles, there's a session, there's a program on writing, professional writing, getting into writing articles. That's a great way to tell your story.
And Anne does that. And I'm just going to put a plug in because Anne pivoted from case management, right?
Yes, I went into publication.
Mhm.
But then the history Lori mentioned about that, where did it come from? Well, at the conference last year, the CMSA conference, there was a panel discussion on the history of case management, 35 years of case management that took it from the very beginning, from when the organization, like 8 people came together for lunch and thought about starting an organization called case management. What is it? Who does it? What's the qualifications? And from that came standards of practice, came ethical issues for case managers. So I put the link in there. You can watch the panel discussion, the 35 years of case management. It is so empowering to see where we were in 1990 to where we are today in 2025. And I left that meeting really believing that, yes, I have contributed. We built this to where we are today. But Stephanie O'Toole, Stephanie D'Annunzia, and anyone else who's on here that is, really new into case management, it's in your hands now. And it's changing because healthcare is changing. So we're here as mentors for you. And that's what why we're all doing this now, is building the future.
Building a
Then
community.
you mentioned, Lori, about, and Marianne too, what you were saying about value. They just came out recently, within the past couple months, on this reimagining the economic value of nursing. It's a report that has been studied and it comes out, it's out now. So copy that link down or take a picture of the chat and go ahead and read that, because that is, we have to define ourselves, and we have to be, as Marianne said, I think, a revenue generating center instead of a cost center. Because if you have readmissions at a nurse, a case manager can help educate a patient so they can take care of themselves, like Christine said, anticipating problems, preventing those problems. That is avoiding a readmission. It's thousands of dollars. And we ourselves as case managers are doing that. It's not being recorded anywhere. So we need to work with our directors, work with our financial people to show where these savings came from. What is our economic value? Because that's all it's about today. It's dollars and cents. But those are reports that I think, if you can watch the webinar, visit Stepping Stones, and read this report, it'll give you some ideas of where you can take the future of case management.
Yeah, and I think that's so valuable, because one of the things I always try to counsel people on who want to get into this is there is sort of a different language and lingo, and if you can become familiar with some of the terminology that you've heard tonight and that you would gain from listening to these various resources, I think that will go a long way during an interview process in being prepared and being able to talk the talk.
Exactly.
And I see Marianne has patiently had her hand up.
I'm so sorry. I just wanted to say 2 things. One, I started doing this back in 1998. To Ann's point, a lot of insurance companies, we had to build case manager departments from the bedside and bring them in and train them to be case managers. But one of the things I want to remind you all too is all these fancy terms we have today. And Ann, I know you'll see this, Deb, population health. And how many of you will say, well, I haven't actually done population health? No, if you're a case manager, you've been doing population health since the beginning of time.
Again, those translatables, transferable skills that you, right.
Somebody just put a fancy term on it, but you have been doing it. So really dig deep into your skill set. And I think an opportunity we're missing in the hospitals is when those floor nurses come in and talk about their patients, to actually educate them. What is this team looking for, the team, the discharge team looking for? And through that, you can identify future case managers, future nurses for quality, future nurses for compliance. You'll start to see when they talk, and we keep missing that opportunity. Stephanie, we have nurse scientists today. We didn't have that before. There's so much. So you guys just excite the hell out of me. I'm so sorry, but I'm going to be quiet now.
No, we appreciate your comments. Thank you.
That's a great comment, and I think just yeah, and I just hope that this is just giving people, nurses out there, a way to dip their toe in a little bit to get an understanding, and just know at Stepping Stone Nurse Academy, we are trying, I am trying to build a community of mentorship and support for nurses out there that are at the bedside and want to make that next move. And I want to say too that I originally thought that I would be meeting with the burned out nurse, like a Stephanie, right? I thought that they would be the one that would be reaching out to me first. But you know what? It's the mid-career and the late career nurses that are coming to Stepping Stone Nurse Academy and saying, what's next? What's next? So, I think this is showing that we all pivot at different times. We have different needs, right? Early in our careers, young families, mid-career, maybe kids are going to college and you're thinking in a different way. And late career, like me, retired and unretired to do this because I felt like I wasn't done yet and that I still had something to give back to the next generation of nurses. So it's very exciting to me. And yeah, I think you wanted to open that up to anybody else that had any
Yes,
questions.
for sure, because we have about 8 minutes or so.
Yeah.
Yeah, so you can either feel free to, of course, just raise your hand or speak out or place any questions that you might have into the chat. Yes, Kennedy, go ahead, please.
Hi, nice to meet you all. I guess my question is kind of vague. Sorry, again, I was a minute late. I was getting off work, but I actually had no idea what I was getting on. My coworker sent me this link to a Facebook reel, and she said, "Just trust me, you need to hop on this." And I've been at work, all day, I work in the CVOR. I'm a CVOR nurse, so cardiovascular, thoracic, critical care surgery for 3 years. That's all I've done right out of school. And I have just been feeling called something I'm very passionate about is patient advocacy. And caring for patients is like my number one thing. And I've heard about case management here and there a little bit, but as I've just been hearing all of you talk, and like this sounds like exactly like I stumbled upon exactly where I'm meant to be right now. And I'm a Christian. I believe God made me be on this call for a minute, like for a reason. And I guess I'm just wondering, like, I guess where do I go from here? I'm super excited. This sounds like an answer to a lot of things that I've been feeling. I feel because I've only been in the CVOR for 3 years, sometimes being in the OR, I've noticed people are like, oh, well, you aren't a real nurse, you're an OR nurse, that's different. That's
Mm.
something I have gotten a lot. Um, and I actually kind of feel like hearing what you guys say, I feel like I'm a case manager in the operating room.
See?
Just kind of
See?
like handling everything, especially in like such a critical environment. So I guess what advice and tips do you guys have? Like, where do I go from here? I mean, this just sounds like really what I've been feeling like I'm searching for.
That's
Kennedy,
fantastic. Go
yeah,
ahead, Lori.
yeah, I think I'll speak to that, and I think I would love to talk to you, Kennedy, too, off of here too. But you can go, and it's in it is in the chat to Stepping Stone Nurse Academy, and you can reach out to me. I take discovery calls all the time, and I can point you in the right direction to connect up with Deb's course on case management if you're interested. Or we can look at other things too. There's like 30 courses between the self-paced course with mentorship that you can take, and the purpose is created just for nurses like you at different stages in your career and wanting to know more and have someone in your corner. And that's what people like that are on this panel. There's so many of us out there that want to help to lift up our profession and continue to help you all. So in the chat, go to that. You can reach out to me. You can go in if you want to just look at the course on case management that Deb has put out there. Deb, do you do a mentorship too? I can't remember if you do a mentorship or not.
We had talked about that, and I'm happy to do that, Lori.
Okay.
Yes.
Okay. So most of them do. You take the paced foundational course, and then I connect you up with a mentor, and you're able to actually go through different sessions and learn more and ask more questions, and they help you meet up with people like a Marianne over there, because she knows the value of the training that you're going to get and the mentorship that you're going to get at the academy. So I hope that you pursue it. I hope I hear from you, Kennedy. I'd love to talk to you more.
And Deb, I just wanted to mention, first of all, um, that you came into this today, Kennedy. There are no coincidences. So, again, that was great that somebody saw that and thought of you. So yeah, put it together. Don't let it go. Keep it in your head. There also is on the Stepping Stones Academy site on patient advocacy. That is another role that nurses can move into. So that's something you can, when you go explore that site, and then talk to Lori on a discovery call. And then Stephanie D'Annunzio, she had her hand up. I think she wanted to say something.
Yes.
Oh, I just had a comment. She said that she worked in the CVOR, but the units that I cover in the hospital are the cardiac ICU and all of the PACUs. So it kind of the best of both worlds. I mean, you still get the cardiac side and ICU level of care, but you still follow up with the patients in the PACU as well, for all different types of surgeries and needs. So I didn't want to stray you away from the Stepping Stone Academy, but if you wanted
it's good that you said that.
Hospital system,
for sure.
If you wanted to stay in the OR or maybe in the PACU, you could do case management for that department, and they would, I'm sure, love to have you.
Perfect.
Thank you guys so much, really. And I've seen the messages and stuff. I'm gonna save everything and go there. So thank you guys so much. I appreciate that.
And Deb, just one more. Stephanie O'Toole said, when Kennedy said about, you're just an OR nurse, she said, people say that about psych nurses too.
For sure. Yeah. Yeah.
But my response, yeah, they do. But the psych nurse, especially today, we're seeing the impact of mental health issues from everything. How important psych nurses are. So again, showing your value. I mean, my gosh, my two nieces, in-laws, through in-laws, they're both, one is a nurse and one is a clinical psychologist, and they're both doing mental health telemedicine. Busy as heck. Working heavy hours, working on the telephone with Zoom to help people with mental health issues. So you are not just a nurse.
Yeah.
I'm sorry, but I just don't understand just a nurse.
It's a mentality.
I don't understand that, because when there's a problem, is there a nurse or a doctor in the room? It's not, is there just a nurse? It's
right.
All right. So
That's
I think
good, Marianne.
has to no. My hands are on my hips going no way.
Yeah. Right.
Yeah,
I
that's so
wanted
true.
to just tag on to the whole the mental health, behavioral health aspect of nursing, because I just experienced this over the weekend with my own parents that are 93 years old, living at home. We have 24/7 in the house, but my mother has dementia and was put on a new psych med. And that was on Wednesday of last week. And by Saturday, this apparently it has a 2.5 day, what is the word I'm looking for?
Half-life.
Yeah. Mm-hmm. So it was accumulating. Okay. And she's 93 and a half, actually. So by Saturday, she was almost unarousable. We could not get her up. And the only way I could wake her was with a really hard sternal rub. And so after 3 hours of her being like that, I ended up calling 911 because I didn't know if she was stroking out, what was happening. And the reason I'm bringing this up is we have an NP who is the nurse that put her on this medication. And do you know that on Saturday, I called in a panic trying to find out what's happening, no answer, no answering machine, nobody on call, no case manager. There is so much opportunity for that behavioral health case manager. And so Sunday, same thing. I brought her home. She's still sleeping, 24 hours later. No, no one to call. I didn't know what to do about the meds. The doctor didn't want to touch the meds because that's outside of their purview, their acute care, there's not enough behavioral health advocacy out there, and there are very few resources. And all I really needed was a behavioral health case manager, and I would have been able to ask these questions. And do you know that I did not get through to anybody to help us until Tuesday? Um, and it was terrible. The one nurse that wrote the script was out sick on Monday, and there was nobody filling in for her. It was a really terrible experience. So that behavioral health is a huge piece. And if they had a case manager, I would have loved to have known her name and phone number.
And
Yeah.
stacking skills, like I started to say in the beginning, and that I encourage Kennedy, that each step you take, if you become more intentional, and you can see down the road by your mentors and the people that you talk to and other nurses, you may start out, you may say, like Stephanie, you may be in mental health. And then you may decide that you want to go into case management and you do that for a while. And then you may decide, I want to become a consultant and have my own business where I can do this kind of thing. So, whatever steps you take and whatever experiences you have as a nurse are very valuable in so many pivotal ways. So, that's
For
just
sure.
what,
Mhm.
yeah.
Yeah, for sure. Well, I think we're just a little bit over time. As I said at the beginning, we're happy to stay on if anyone has any other further comments or questions. But thank you so much. Hopefully, you found this to be informative. I really enjoyed working with everyone this evening. So thanks for attending, and we look forward to the next one.
Thank you.
Thank
Bye,
you.
everybody. Thank
Thank
you.
you.
All right. Thank you, everyone.
Bye bye.
Have a good day, guys.
All right. Bye bye now.
Thank
So,
you. Bye.
bye. Nice to see you.
You.
We're on, but let me turn the, hold on, stop.